Breast imaging, comprehensive overview. Breast imaging refers to a set of diagnostic tools and techniques used to evaluate breast anatomy, detect abnormalities, and guide treatment. It plays a critical role in screening, diagnosing, and monitoring breast diseases, especially breast cancer. Below is a detailed account of breast imaging modalities, their indications, advantages, and limitations. Modalities of breast imaging. 1. Mammography. Introduction. Mammography uses low dose X rays to detect abnormalities in breast tissue. It is the most widely used screening tool for breast cancer. Types. Conventional mammography produces 2D images of the breast. Digital mammography uses digital detectors, offering better image quality and storage. Tomosynthesis, 3D mammography, captures multiple images to construct a 3D representation of the breast. Indications, routine screening for women aged 40 and above, evaluation of palpable breast lumps, surveillance in high-risk individuals. Advantages, effective for detecting calcifications and masses, quick and widely available. Limitations, lower sensitivity in dense breasts, radiation exposure, though minimal. 2. Breast ultrasound. Introduction, uses high-frequency sound waves to generate real-time images of breast tissue. Indications, evaluation of breast lumps, solid versus cystic lesions, complementary to mammography in dense breasts, guidance for biopsies and cyst aspirations. Advantages, safe, no radiation exposure, useful for characterizing lesions and assessing axillary lymph nodes. Limitations, operator dependent, limited ability to detect microcalcifications. 3. Magnetic resonance imaging, MRI, introduction, uses powerful magnets and radio waves to produce detailed images of breast tissue, often combined with gadolinium-based contrast agents. Indications, screening in high-risk patients, e.g. BRCA mutations, preoperative staging of known breast cancer, evaluation of implant integrity, assessing response to neoadjuvant therapy. Advantages, high sensitivity for detecting lesions, no radiation exposure. Limitations, expensive and less widely available. False positives, requiring further evaluation. Hashnar 4, contrast-enhanced mammography, see introduction, combines mammography with an intravenous contrast agent to highlight vascularity in suspicious lesions. Indications, alternative to MRI in certain scenarios. Evaluation of lesion vascularity. Advantages, faster and less costly than MRI. Effective for dense breasts. Limitations, limited availability. Requires IV contrast, risk of allergic reactions. 5. Nuclear imaging, molecular breast imaging, MBI, uses a radioactive tracer to detect breast cancer at the cellular level. Indications, dense breasts, inconclusive mammography or MRI. Limitations, expensive, radiation exposure. Positron emission tomograph PET scan evaluates metastatic or recurrent breast cancer. 6. Thermography, introduction, detects heat patterns and blood flow in breast tissue using infrared cameras. Advantages, non-invasive and radiation-free. Limitations, low sensitivity and specificity, not recommended as a standalone tool. 7. Elastography, introduction, an advanced ultrasound technique that assesses tissue stiffness to distinguish benign from malignant lesions. Advantages, improves diagnostic accuracy of ultrasound. Limitations, operator dependent. Comparison of modalities, modality sensitivity, specificity, best for, high dense breasts, mammography moderate high, routine screening. Ultrasound, moderate high, moderate evaluating dense breasts. MRI high, moderate high risk screening staging. CEM, high, dense breasts alternative to MRI. PET MBI, moderate high, high, metastasis evaluation. Emerging technologies. 1. Artificial intelligence, AI. AI algorithms enhance diagnostic accuracy by analyzing images for suspicious patterns, reduces false negatives, and improves workflow efficiency. 2. Radiomics extracts quantitative features from medical images for predictive modeling. 3. Photoacoustic imaging combines light and sound to assess vascular structures in tumors. Indications for breast imaging. 1. Screening, detecting early-stage breast cancer in asymptomatic women. 2. Diagnostic, evaluating symptomatic presentations such as lumps, nipple discharge, or skin changes. 3. Staging and follow-up, assessing disease extent and monitoring treatment response. 4. Interventional, image guidance for biopsies, aspirations, and localization procedures. Challenges in breast imaging: dense breast tissue reducing mammographic sensitivity, radiation exposure concerns with repeated imaging, accessibility and affordability in low resource settings. Conclusion: breast imaging continues to evolve with advancements in technology, improving early detection and outcomes in breast disease management. An individualized approach, considering the patient's risk profile, breast density, and clinical scenario, ensures optimal utilization of these modalities.